Hello, welcome. From the past several videos, we are discussing about the electrocardiogram. What actually electrocardiogram is, what are the indications of electrocardiogram, and what is considered to be the normal electrocardiogram contains. The contents of normal electrocardiogram, and what are the electrocardiographic leads, what are these conventional leads, and what do you mean by the frontal plane leads and horizontal plane leads. After that, we have discussed about the hexaxial reference system or axis wheel and how to identify the electrical axis or ventricular axis. What are the three different methods of identification of ventricular axis were being discussed. In this particular video, we are going to discuss how to read the electrocardiogram. This video may go a little bit longer. This will be discussing with the different examples also, and what are the things that are going to get documented that will be recorded methodically, documented that will be recorded in this particular video. When you document the electrocardiogram, what we can say the reading of the electrocardiogram, the following points they are going to be get considered. For example, these are the points as such: calibration, rate, rhythm, mechanism, P wave, PR interval, QRS complex, that is width, axis and configuration, ST segment, T wave. If U wave is present, the details of U wave, comments and conclusion, plus additional remarks that can be recorded in this particular reading the electrocardiogram. When you think about the calibration, so that is what is considered to be the two large boxes. They are considered to be standard ones. So that means whenever if you are seeing this the rectangle which is having the two large boxes or 1 centimeter height, then it is considered to be standard calibration. Calibration is standardized. If that is considered to be half standard, in the sense that will be having the one large box and two standard, that is in the sense 2x, that means it is having the 4 large boxes. So most of the ECG recordings, they will be having the height of what do you say, that calibration is of 1 centimeter height, as a, or otherwise having the two large boxes. This will be present at the beginning of the electrocardiographic recording. Next, about the calculating the heart rate. How to calculate the heart rate? It is being defined as heart rate is equal to 1500 divided by the number of small squares between the two consecutive R waves. That means peak of the R wave, or otherwise it is also being calculated as 300 divided by the number of large squares between the two peaks of consecutive R waves. This is actually giving us the ventricular rate. When you are calculating the atrial rate, this is being said to be 1000 by 100 divided by the number of small squares between the two successive P waves, or otherwise 300 divided by the number of large squares between two peaks of between the two successive P waves. That is onset of P wave. That is going to give us the atrial rate. Normally, atrial rate is equal to ventricular rate. Now let us see different examples. In this particular example, see the RR interval is having the 20 small squares, or otherwise 4 large squares. If you are calculating the heart rate in this particular example, it is 1500 divided by 20, or otherwise 300 divided by 4, that is giving us the heart rate of 75 per minute. In this particular example, see the heart rate is being calculated as the number of RR interval that is the large squares between the two RR intervals is considered to be 2 or otherwise 10 small squares, the heart rate in this particular occasion is 150 per minute. It is being said that heart rate more than 100 is considered to be tachycardia. Look at this example. The RR interval is 33 small squares or otherwise 6.5 large squares. When you calculate 300 divided by 6.5 or otherwise 1500 divided by 33, so the heart rate is something around 47 beats per minute. That means heart rate less than 60 is termed as bradycardia. In this particular example, again, heart rate is again 33 small squares or 6.5 large squares. Heart rate is 47 beats per minute. It's a case of bradycardia. So when you think about the rhythm of the heart, so is basically it is being recorded based on the bottom strip, or otherwise it is also being termed as rhythm strip. Here what we are going to see is, here we are going to see the distance between the two consecutive R waves. It has to be written as either regular or regularly irregular or irregularly irregular. And the next thing what you have to note is, you have to check for a P wave before QRS complex. And you have to see the check PR interval, QRS interval and QT interval also. So that means whenever if you are looking into the rhythm of the heart, you have to see the P wave for every QRS complex and it has to be constant. Then PR interval, QRS interval, QT interval, they will be constant for every beat. Then you are going to say the rhythm is regular. If that is not regular, that may be either regularly irregular or irregularly irregular. So this is an example where you are going to see the P wave is present for every QRS complex. A PR interval is constant. QRS interval is constant. QT interval is constant for every beat. So this is termed as, what you say, that the rhythm of the heart is regular in this particular example. When you see this particular example, again, PR interval is, P wave is present for every QRS complex. PR interval, QRS interval, QT interval is constant. And here PR interval is 0.12 second. One small square, 0.04 second. Three small squares in the sense, that is 0.12 seconds. Look at this example. So here it is considered to be regularly irregular. So see this, there is 4 beat. After that there is a gap. Then again it's a 4 beat. Definitely there is a one more little bit lengthier rhythm was being required, but here it is a smaller one. When you think about it, of course there may be a possibility of pause after 4 beats. In that particular sense, we are going to say rhythm is regularly irregular. So here P wave is present, QRS complex is present, PR interval is constant, QRS interval is constant, QT interval is constant, and P wave is present for every QRS complex except one missed beat, that is the regularly irregular rhythm. So when you think about this particular example, rhythm is again regular, whereas the condition is termed as P wave is present for every QRS complex, PR interval is constant, QRS interval is constant, QT interval is constant, and heart rate is 150 beats per minute. It's a case of tachycardia. As P wave is present for every QRS complex, this is being termed as sinus tachycardia. Next, about the P wave. P wave actually denotes atrial depolarization, as we discussed earlier. It has 2 components, initial component and terminal component. Initial component represents right atrial depolarization, whereas terminal component represents left atrial depolarization. When you think about the characters of a P wave, that is a pyramidal shaped one with smooth limbs, with no irregularities normally. As far as the dimension of the P wave is concerned, it is less than 2.5 small squares in x-axis and less than 2.5 small squares in y-axis. Or otherwise, we can say less than 2.5 mm in x-axis and 2.5 mm in less than 2.5 mm in y-axis. This is about the description of P wave. Look at this particular P wave. Whenever if you see that ideally lead 2 and V1 are actually same. In case of lead 2, we can see the both the components of P wave. Reason is, whenever if you see that the electrical axis, specifically in case of atrial depolarization, will be parallel to lead 2. Hence, we are going to see the accurate picture of atrial depolarization in P wave. Whereas, in case of the V1, we are going to see the biphasic picture. So that means initially there will be upward deflection, later that will be followed by downward deflection, indicating right atrial depolarization first, followed by left atrial depolarization. That is the typical nature of what you say that the V1, that is biphasic deflection of P wave. So here also we can see the biphasic deflection in case of V1. Of course, in the first here, that is, we are going to see the biphasic deflection. That is also the not that much clear pattern of biphasic deflection in case of V1 is being noted here. In this particular example, P wave is having normal configuration. So that means height and width less than 2.5 small squares. In this particular example, P wave is having normal configuration. So that is the wave that is specifically seen in lead 2. Of course, lead 1 is also, we can see the P wave. Lead AVR also we are having the P wave, AVL and AVF. We can see the P wave, but lead 3, we cannot able to differentiate P wave. Next about PR interval. And think about the PR interval. By definition, it is the time duration between the onset of P wave till the onset of QRS complex. Normal PR interval is 3 to 5 small squares. So that means 0.12 to 0.2 seconds. That is the normal PR interval. In this particular example, the PR interval is up to 3 small squares. So that is PR interval is 0.12 seconds. Look at this particular example. Here PR interval is 4 small squares, that is 0.16 seconds. The PR interval between 0.12 to 0.2 seconds, they are considered to be normal. In this particular example, PR interval is 3 small squares, that is the 0.12 seconds. When the PR interval is more than 0.2 seconds, so that means more than 5 small squares, then it is indicative of a atrioventricular block, or otherwise what we can say the nodal block. In this particular example, PR interval is 0.12 seconds. This is again in normal range. Next about QRS complex width. Normal QRS complex width, when you say about it, that is nothing but QRS interval. It is being defined as the time duration between the onset of Q wave till the onset of a QRS complex. When you think about it, the normal QRS interval is less than 3 small squares. So that means less than 0.12 seconds. In this particular example, PR interval is having the two small squares, that is 0.08 seconds, that is within normal range. When you think about this particular example, that is termed as, again, QRS interval is less than two small squares, that is up to two small squares, that is 0.08 seconds. Next, about the QRS width in this particular example. So QRS interval is more than three small squares. That is indicative of the pathology in the conduction as such, electrical system. That is, either it may be in the sinoatrial node or in the atrioventricular node, etc. that can be predicted. In this particular example, QRS interval is more than 0.12 seconds. That means it is suggestive of a disturbance in the conduction system. In this particular example, less than 0.12 seconds, normal range. Next, about the QRS axis. As we have discussed in the previous video, the QRS axis lies between -30 to +110 degree. When the QRS axis is less than -30 up to -90, then we are going to say it is a left axis deviation. If it is more than 110, it is present up to plus or minus 180, then it is said to be right axis deviation. When you think about the identification, so here there are the two different methods. That is, you have to see about the rule 1, that is equal biphasic deflection. You have to note about it. Then you have to see the perpendicular axis towards that particular biphasic deflection lead. Then based on that, you are going to identify which lead is having positive deflection among those adjacent leads which are being noted after seeing the biphasic deflection towards that one particular lead. Then we are going to say electrical axis is towards the lead where there is the positive deflection is being seen. Or otherwise, we have to draw the electrical axis on the x-axis reference system wherein any two leads can be taken. Or otherwise, there is one more phenomena, that is left leaves and right reaches. So this when do you say left leaves, right reaches? In the sense, we are going to see that particular example in the coming slides. When you see this QRS axis, when you think about this, ideally see exactly the QRS axis is biphasic in cases of a lead 3. So that means here we have applied rule 1. So that means the perpendicularly that we need to look into is AVR and lead 2. When you see this, AVR is having prominent negative deflection and lead 2 is having prominent positive deflection. Hence, the electrical axis will be, in this particular example, is moving towards the lead 2. Hence, the electrical axis in this particular example is plus 30 degree. In this particular example, lead AVL is having prominent negative deflection. So that means the electrical axis, when you think about it, the lead 2 is having biphasic deflection. So that means the electrical axis of this particular example will be plus 1 if that is the T plus 90 plus 150 degree. That means it is a case of a right axis deviation. So here left leaves and right reaches. When you think about this particular formula, say the lead 1 kept above, if you see the lead 3 kept below, they appears to be reaching towards each other. So that means it is considered to be right reaches. It is indicative of a right axis deviation. So when you think about the other aspect, left leaves, So that means the lead 1 will be having prominent positive deflection and lead 3 is having prominent negative deflection. It appears to be leaning towards each other. So that means it is indicative of a left axis deviation. This is another formula where we are going to say about the the axis deviations. In this particular example, so lead AVL is having almost equiphasic deflection. The position of lead AVL is -30. Electrical axis of this particular example, when you see that, we have to see the other two leads, that is lead 2 and AVR. So lead 2 is having prominent positive deflection and AVR is having prominent negative deflection. Electrical axis of this particular example will be plus 60. In this particular example, electrical axis, when you see that lead 1 is having the biphasic deflection, and you think about the lead AVF is having the prominent positive deflection. Electrical axis of this particular example will be plus 90. In this particular example, see lead AVL, so lead 1 is having biphasic deflection, but lead AVF is having negative deflection. So that means electrical axis of this particular example will be -90. And look at the V1 and V2. It appears to be R dash pattern. It's a case of a, what do you say, that the right bundle branch block. And this particular sign is called the R dash pattern, or otherwise rabbit ears pattern. When you are observing this R dash or rabbit ears pattern in lead V1 or V2, it is indicative of a right bundle branch block, RBBB. In this particular example, electrical axis will be -30. See, it's again a case of right bundle branch block. In this particular example, lead AVL is having almost equiphasic deflection and lead 2 is having the prominent positive deflection. Electrical axis in this particular example is plus 60. In this particular example, whenever if you see this, here rule 3 can be applied, not rule 1 or rule 2, because here we are having only two leads. Here there is no specific biphasic deflection, hence we cannot apply rule 1. And here there are no, what do you say, that the equal QRS complexes, that is rule 2 cannot be applied. The only way that can be applied will be rule 3. And here it amounts to be 0 degree. In this particular example, electrical axis is considered to be -60. That is the in this particular example, electrical axis is plus 120. That is, it's a case of right axis deviation. So here AVR, we are going to say having minimum deflection. Based on that, we are going to say that is the position of lead AVR is -150. Hence, as the lead 3 is having prominent positive deflection, perpendicular to that, the value will be plus 120. It's a case of a right axis deviation. Again, it's a case of right axis deviation. Next, about the QRS configuration. So in this particular column, we are going to say whether it has Q wave or R wave or S wave or R dash wave or S dash wave, that has to be written. So deep Q wave is being present in which are the leads, that has to be noted. Whether is it present in the lead 1, 2, 3, AVR, AVL or AVF, V1, V2, V3, V4, V5 or V6. Tall R wave present in which are the leads, that has to be noted. Deep S wave are present in which are the leads, that has to be noted. Any abnormal pattern in the leads such as R dash wave, etc., that has to be noted. Or ST segment elevation or ST segment depression, that means that has to be noted here. That means R dash wave or RSR dash wave or QS complex, that has to be recorded in this particular column. And pattern of the QRS complex in different leads has to be recorded. When you think about the QRS configuration, see this. In this particular example, it is RR dash pattern, or what we can say the right rabbit ears pattern, specifically seen in cases of a right bundle branch block. Specifically rabbit ears seen in V2, whereas V1, the initial R wave is smaller, R dash wave is having a even taller. That is, it's a case of right bundle branch block. Next, about ST segment. ST segment, we have to know whether it is elevated, that means ST elevation is present, or whether is it depressed or ST depression is present, or the ST segment is isoelectric. That means there is no upward or downward deflection has to be noted. ST segment elevation are present, which are the leads among the 12 conventional leads, that has to be noted. And ST segment depression is present, which are the leads, that has to be noted. And ST segment is isoelectric, in which are the leads, that has to be noted. So here, when you think about it, lead V2, we can see the ST segment depression. Next, about the T wave and U wave. Whether is it tall wave or flat T wave or symmetrical wave or inverted T wave, that has to be noted. Tall and symmetrical waves are present, which are the leads, that has to be noted. 1, 2, 3, AVR, AVL and AVF, etc., that has to be noted. And U wave present in which are the leads. Specifically, U wave is seen in chest leads V3, V4 and V5. Other than that, U wave will not be seen in majority of the conventional leads. We cannot see the U wave. As far as comments are concerned, P pulmonale, that means where the width of the P wave will be more, and P mitral, where the width of the P wave will be more, and where the height of the P wave will be more in cases of P pulmonale. P mitral is indicative of left atrial enlargement, and P pulmonale is indicative of right atrial enlargement. In case of first degree AV block, we are going to see the, what do you say, that the PR interval is prolonged. In case of the right axis deviation, the electrical axis will be between the plus 110 to plus or minus 180. Where in right atrial enlargement, we can see the tall P wave more than 2.5 small squares. Whereas in case of the left axis deviation, the electrical axis will be lying between minus 30 to minus 90. Left atrial enlargement, where the width of the P wave will be more than 2.5 small squares, and it's a notched P wave. Whereas right bundle branch block, as such, where we can see the rabbit ears pattern. So these are the different comments we can able to put while recording the electrocardiogram. Regarding the conclusions, what are the different suggested terminologies? So that is normal electrocardiogram, we can write, or otherwise electrocardiogram is in normal limits, or electrocardiogram is in borderline electrocardiogram. We need to know about the different features. For example, regarding the left ventricular hypertrophy, etc., that we are going to write it. Whereas abnormal ECG suggestive of dash, whether is it the P pulmonale or P mitral or right bundle branch block, etc., or abnormal ECG is consisted with P mitral or P pulmonale, etc. And abnormal non-specific ECG, that we have to note about the abnormal features has to be written. And additional remarks. When you think about the additional remarks, we have to compare with the previous records. And by looking into that, we have to suggest the serial records. Specifically, in case of person who is suffering from myocardial infarction, we are going to repeatedly record the electrocardiogram. And if there is the additional leads, suppose if the person is in dextrocardia, probably we have to keep the leads in the different position and record the standard lead in case of deep inspiration and expiration to know about the arrhythmias. And if the person is having the ischemic heart diseases, etc., then we are going to do the exercise test such as treadmill test or TMT. So these are the ways of recording the electrocardiogram. So the take-home messages from today's discussion are: specifically ECG reading is essential, specifically for an Ayurveda learner or scholar. So why we need to know about it? Because whenever we are planning the Panchakarma therapy, Vamana is always contraindicated in the person who is suffering from cardiac diseases because it is giving more and more burden to the heart itself. There may be a possibility of collapse of the patient itself. And while giving the Samshodhana line of treatment or purification therapy, that is Virechana or Basti, Nasya, etc., cardiac assessment is very, very essential. As far as noting the documents of electrocardiogram, we are going to note about calibration, heart rate, rhythm, mechanism. Mechanism as such, P wave will be present for every QRS complex. And if P wave is shorter, that means less than 3 small squares, then we are going to predict the possible the pacemaker function is being taken up by the AV node. So that means mechanism in the sense whether it is sinus mechanism or nodal mechanism or ventricular mechanism that can be noted. P wave, PR interval, QRS complex in terms of width, axis and configuration, ST segment, T wave, comments, conclusion and additional remarks has to be noted if you are documenting the readings of electrocardiogram methodically. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Ayurveda learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.